joined, I was waiting for an NHS performer number, so I couldn't do any NHS dentistry. But to get me exposed to dentistry, we decided to come up with a low-cost NHS equivalent, but privately. So basically, a patient would book an appointment, and it would be £25 for a checkup, which would be more or less equivalent to a band 1 checkup, have their x-rays done, and if they needed any treatment, we would try and make an equivalent cost to NHS. So someone that came in that needed a filling, it would be £65 or £60. But if they needed any subsequent fillings, we would give them a 50% reduction. So if they needed 3 more fillings, each one would be about £30. If they needed a crown or dentures, that would be more like a band 3 treatment, so say 250. But if they needed several crowns, each one would be 250. But it definitely gave people the opportunity to, if they couldn't get an NHS place, the cost of private treatment wasn't prohibitive to them. So again, because I was waiting, instead of just doing nothing, I was able to get immersed into dentistry pretty quickly without actually having the pressures of private dentistry, because patients have certain expectations and it does take a bit of time and experience to get used to materials and treatment and interacting with patients. So it was good to get into dentistry, practice, get my hands wet, as you could say, without the pressures of more intense dentistry. So when we were graduating, the entire cohort, we were all pretty worried about coming to the UK, trying to find jobs. And we all heard horror stories about people getting into long-term contracts for poor pay and not progressing very far. But Neeraj Didi and Ian Gordon had an interview with them, and it was completely different with them. They were very much supportive. They didn't want to tie me down with anything. They very much stressed it wasn't a long-term contract, but they believed that if I joined them, I'd want to join on the long term. And just the whole ethos of being supportive and patient care orientated and development of their dentists definitely swayed me to them. Probably the professional development. They're constantly putting on courses and trying really, really hard to make sure that their dentists have opportunities to improve themselves and progress. Definitely not a place where you just come 9 to 5, that's it, and possibly stagnate. They're always putting on courses. They're very, very involved, sending emails out, always trying to get top, dentists in the country to do lectures and do courses. So the more the merrier, really. I've been on quite a few. I would say try and find somewhere that you can progress. It's a long career and it's important to enjoy what you do. So definitely try and find a place or a company or a practice that you have the option to progress and they're encouraging of it. Because it's a lot easier to do well when the entire team is behind you.